cyclospora cases are continuing to rise in North Carolina.
The state confirms at least 240 cases have been reported since May 1st. That's up from 110 just a week ago. It's a horrible illness. The parasite often isn't diagnosed until a patient seeks medical attention. One North Carolina man told WRAL he thought it was just a normal stomach bug until the symptoms refused to let up.
For me, it was the duration of the explosive diarrhea that everyone's talking about. It was a long time. It wasn't just like, oh, I wake up, I had an extra cup of coffee, and it was like, oh man, things are bad. No, it was several days worth, weight loss, dehydration, just feeling of just generally fatigued.
Nationwide, the CDC says more than 840 cases have been acquired here in the U.S. this season, with another 1,500 under investigation. Federal funding and state budget decisions are raising questions about whether public health teams have the resources to respond to the cyclospora spread.
WRAL state government reporter Caroline Yaffa joining us now live outside of the Department of Health and Human Services. Caroline, what are you learning about the effort to track the source of the outbreak?
Gerald and Ashley, that's a great question. And I talked to several state agencies today, including DHHS, which is behind me, and they are key players in this investigation. And tracking down a parasite like this takes a lot of work and resources. So we asked state agencies today if they have enough funding and resources from the federal government and state government to actually figure out what's behind this.
At least more than 240 cyclosporiasis cases have been reported in North Carolina, with Wake County seeing the largest share.
What's hard about cyclosporiasis is it's hard to prevent it.
Because symptoms can appear weeks later, investigators have to work backwards, interviewing patients, looking for connections, and tracing possible exposures.
From the local level, we get a lot of support for communicable disease outbreaks from the state, and I believe the state gets support from the federal government.
The chain of support is changing. The CDC recently scaled back its foodborne diseases active surveillance network, ending required active tracking of cyclosporiasis. North Carolina is also dealing with broader federal public health funding changes, affecting programs statewide. In the newly passed budget, the program leading these investigations saw a $2.5 million funding decrease, though officials say that was tied to other costs that were actually being funded by the federal government, not a cut to foodborne illness response. And lawmakers say if this gets bad, they could step in.
We are always advocating to our federal partners for increased help with situations like this if it gets to that level, and we need to start advocating harder for federal help on these type of issues.
Several state agencies, including the Department of Health and Human Services and the Department of Agriculture, tell me that they're working in partnership with federal officials and local officials to protect North Carolinians and do what they can to help. Caroline Yaffa, WRAL News, live in Raleigh.
All right, Caroline, you can find everything you need to know about cyclospora cases, how it spreads, what else your family needs to know to keep safe and healthy. It's all on our WRAL YouTube page.